Hello again, and thank you all for joining us today for this webinar, Financing the Future, Securing Immunization Coverage in Africa high-level webinar. I'm sure you'd agree that this is a very important topic that we are discussing today. Just before we start off, please note that if French is your preferred language, there is an option of interpretation for this session today. Please click on the globe icon in the toolbar at the bottom of your screen and select your preferred language. I will repeat, if French is your preferred language, we're offering that option for you today. Please click the globe icon in the toolbar at the bottom of your screen and select your preferred language. Okay, so as a way of introduction, I'll be moderating this session today, as you have probably already noticed. My name is Budzai Magadzire, and I'm the Director of Partnerships at Village Reach. I am based in Cape Town, South Africa. I am also the board representative for the Civil Society Constituency on the GAVI board. I'm a public health professional with many years of experience on the intersection of health and development. And I have a particular interest in advancing the responsive primary healthcare agenda to achieve universal health coverage, which I am sure is a shared interest with many of you on this call. As we start the meeting, and as many more people are joining, we would love to know where you are dialing in from. And so if you haven't already done so, please add in the chat where you're joining us from and which organization or entity you're representing. I believe today we are going to have diverse representation from government. I already see Emily Chirwa has written in the chat, and you will hear from her later. We'll also have others from development partners, from donors, and members of civil society from all over the world. And we truly, truly, as we begin this session, want to thank you all for being here and joining in this very important conversation. In terms of the ground rules, I'm not going to tell you anything new. I will just request that we all remain muted unless called upon to speak, so that there are no interruptions. I also encourage all of us to remain actively engaged in the conversation. We only have an hour and a half for a very interesting and important conversation. And so we recognize that we won't be able to cover everything in 1.5 hours, but keep the chat box alive. Put in your comments, put in your questions. There's a team that is going to be monitoring that chat box. And as much as we can, we will engage on some of those comments and questions, and then we'll figure out a way to engage on the things that we won't get to today. So to kick us off this afternoon, I'm going to call upon Ms. Rachel Ndirangu, the Regional Director for Advocacy and Public Policy at PATH, to give the opening remarks together with the objectives and overall framing for our conversation today. Over to you, Rachel.
Thank you very much, Budzai, and everyone else. It's really a pleasure and an honor to be in this room with all you distinguished groups of leaders, advocates, and everyone taking part in this race, actually, to securing immunization coverage for Africa and essentially securing the future, of our children and our population. As we've all seen from the 2024 WHO UNICEF data, global immunization rates are still recovering from the setbacks caused by the last pandemic. We all know this. And with over 11 million children in especially GAVI-supported countries missing out on crucial vaccinations in 2023. This is really a worrying trend, an increase in zero-dose children since 2022. And these are not just numbers, so we should not look at these as just numbers, but really lives left to vulnerabilities to preventable diseases, and we cannot allow this gap to widen. I think that's why we are all here, to make sure that we can rally behind the call to financing and securing the future of our populations. Immunization is and will always and has always been, a cornerstone of public health. And by ensuring universal vaccine coverage requires more than just a strong health system. It demands sustainable and long-term financing, as we all know. And that is why we have gathered here today with the goal to explore, innovative ways to mobilize resources, both globally and domestically, to safeguard the future of our children. This vaccination campaign that path in partnership with WACI Health, the GAVI CSO Constituency, and Village Reach, and all these partners involved, is really a call to action for increased funding commitments. But we must remember that, we cannot talk about funding and financing without accountability. So accountability is really key. And so we must ensure that the funds mobilized across, global health initiatives at the national level are used optimally, they're used efficiently and transparently, and reach the communities that most need them. And so in this conversation today, really looking forward to reflecting together on a couple of things. One, would like to take this opportunity to share the results of recent studies on immunization financing, focusing on challenges, opportunities in various countries. Would also like to provide an opportunity as, stakeholders here to really pause and reflect on the impact of the shrinking fiscal space in national and global immunization financing. What does that really mean, even as we put forward the call for increased financing? The third thing we'd want to achieve in this conversation today is really to shine a light on successful financing and accountability models that can be replicated or scaled up. So you'll see there's a lot of learning, there's a lot of reflection, and so your contributions will be very, very important. So in the next 80 minutes or so, let us think bold steps we need to take forward as we share experiences, as we discuss solutions on financing and immunization. How can we address the challenges, that threaten our progress, and together, how can we drive the real change and work towards achieving our goals? So looking forward to fruitful discussions, and back to you, Vudzai. Thank you.
Thank you so much, Rachel. Thank you for setting us on our way in such a profound way. Colleagues, I see that the chat is ablaze with introductions. Thank you. For those who've just joined, put in your name and your organization so that we know where you're dialing in from and which organization you're representing. We're now going to delve into a very quick survey where we want to hear from you on two key questions. It's important that as we go through this conversation today, you're not just hearing people speak to you, but that you're also contributing and sharing your experience and knowledge, because there's a lot of rich knowledge in the room. And so I'm going to ask those who are assisting us with the logistics behind the scenes to project the questions that we are going to be answering through the Menti. Thank you. So I see that the Menti is on there, and the code that you need to use to go in. I'm sure many of you are already familiar with Mentimeter. Let's just give people a minute to take note of that. Perhaps colleagues from PATH, perhaps you can also put the code in the chat so that we can start with those who are already in the survey. Can put the link and the code in the chat. Okay, let's go in to the first question. The first question is, how has the shrinking fiscal space impacted immunization efforts in your country? You can mention your country in your response as well, so that we know which context you're referring to. You have 2 minutes to answer that question. How has the shrinking fiscal space impacted immunization efforts in your country? I see some answers are already coming in. I see a response from Kenya. Thank you very much. Keep the responses coming. We've got 8 responses in now. Right, so from what we're seeing here, thanks for the responses that are coming in. We just have to move to the second question for the sake of time. So your second question is, what strategies can be implemented to effectively mitigate the impact of reduced funding on immunization efforts? So again, there's a critical mass of brain power here, and we want to take advantage of that so that we can think together about what is it that we can do together to reduce the impact of funding on immunization efforts.
Butsa, you're muted.
Oh, sorry. Thank you, Esther. So a lot of good ideas that are coming through there. I think there seems to be a common theme around just the need for increased domestic funding that I see there. I also see advocacy with donors and the World Bank. I also see evidence-based advocacy. It looks like there are a lot of advocates who are in the room today. Ring fencing of funds for immunization. That's a very interesting one. That's coming from Ghana. So it does appear, from what we are seeing, that there is a level of agreement on where we think our efforts should be, particularly around domestic financing. But also, even for the first question, there seemed to be some commonalities in what the challenges have been with a shrinking fiscal space. So increased zero dose was among some of the issues that I saw, and reduced coverage rates. So those seem to be common threads that we are sharing as we are on the call today. Thank you so much. Unfortunately, I have to cut this fun activity because of time, but feel free to continue to put in the chat some ideas. Perhaps our team can also log the questions in the chat so that people can continue to deliberate and think about them. Okay. So now we are moving on to the next segment of our webinar, where we are going to be hearing from a diverse pool of speakers. Our distinguished speakers for today, Honorable Mokutu Joseph Makalanyane of Lesotho. We also have Dr. Mike Mulongo from Perth. You are seeing the Honorable there, and Dr. Mike Mulongo from Perth. We also have Mr. Jimmy Ameni from the Ministry of Health in Uganda. That's Will that you're seeing there, so I can introduce Will. Dr. William Manson, the Senior Manager for Immunization Financing and Sustainability at GAVI. And then we also have Jim Ameni, I already mentioned, the coordinator for GAVI grants at the Ministry of Health. And then we also have Ms. Emily Chirwa, who is the Deputy Director of Health Financing and Budgeting. So here I went through their names very quickly, and I will give you their brief bios just before they come to speak. So without further ado, our first speaker, whom we are calling the spotlight speaker for today, is Honorable Mokutu Joseph Makalanyane. He is the chairperson of the Health Committee in Lesotho and the chairperson of the Network of African Parliamentary Committees of Health. Today, in this session, Honorable Makalanyane will provide valuable insights into health financing in Africa, particularly its impact on immunization. He will also explore the opportunities for the region to collaborate with the network of African Parliamentary Committees on Health, which he currently chairs. Thank you, and over to you, Honorable. I see Honorable's presentation is up, but I cannot hear him speak. Can you hear us, Honorable? Okay. Perhaps as Honorable Mokutu is trying to get connected, for the sake of time, we will move on to the next speaker and then we can come back to him. So I'm going to call upon Dr. Mike Mulongo from PATH. He is a medical doctor and Mandela Washington Fellow, Business and Entrepreneurship. Dr. Mike has over 10 years experience in healthcare delivery. He has been the technical lead in health financing and system strengthening consultancies at local, regional, and global level. In 2023, last year, PATH set out to assess the progress in the implementation of the Addis Declaration in 10 countries. A retrospective study on the status of immunization financing, including factors affecting adequate financing for immunization, was conducted by reviewing secondary data from various sources. Dr. Mike is here to share with us the findings from that 10-year study. Over to you, Dr. Mike Mulongo.
Thank you very much, Wutai, and it's a pleasure to be part of this conversation. Thank you very much for setting the stage, Rachel, as well as you sharing the intros, as it were, and also the Menti itself helped set the ground very well. So I will just share my screen in the interest of time so that we redeem the little time that we have. Just as has been mentioned, I'm a health financing specialist, and I was happy to support PATH and the partners to do this assessment across 10 countries, and we can see them distributed across Africa, and all these are 10 Africa Union member states. Looking at both countries, most of these countries were in sub-Saharan Africa, English-speaking, Francophone-speaking, and also Portuguese-speaking, represented by Mozambique. Our focus was largely anchored on the premise that immunization financing doesn't happen in a vacuum. It happens within a context, and that context goes beyond immunization. To that extent, then, we had to look at the population factors, the demographic context, looking at the economic environment, so the macroeconomic and macro-fiscal context of the respective countries, because that influences how much of those resources flow into health, and then ultimately into immunization. We also looked at a bit around the health system performance for the respective countries, immunization coverage, and then how much is health priority, or how well is health prioritized, and then from that looking at how much then flows into immunization, and a little bit around efficiencies of purchasing and procurement of vaccines and immunization commodities, as it were. The point being, immunization financing doesn't happen within a vacuum. It happens within a context that is affected by multiple other dynamics beyond the health sector. A quick run on this just demonstrates the eligibility guideline for GAVI, and I'm happy to have Dr. Will and we have Jimmy here. I mean, they're a better place to have this conversation, but just suffice to note that countries are at different stages based on their gross national income per capita. And for the 10 countries we were looking at, a majority of them were in the initial self-financing stage, where they essentially just pay 20 cents for the vaccine products. Only Kenya and Nigeria were in the accelerated transition phase, which is the third phase, where you essentially are meant to be increasing your the contributions that the countries are making towards procurement of vaccines, towards ensuring that you fully cover everything within 8 years. None was in the fully self-financing stage. I think this is just important for purposes of context. Now, looking at the economic context, I think what stood out is the fact that public finance system factors that, now talking about taxation, talking about debt, and just looking at the size of the economy becomes very critical if you're looking at the resources that are available to finance not just health or immunization, but the entire economy, as it were. So we note that across the 10 countries, if you're looking at tax, which is a blue or purple line, the desire is that countries should mobilize more than 15% of their GDP. Only Mozambique hit that target. The rest were below that. Senegal was slightly above that, about 17, same to Comoros, but the majority were below 15%. That means you're not mobilizing adequately. I saw one of the constant themes that came up in the Menti is domestic financing. Taxation becomes one of the most predictable and most reliable sources. But suffice to note that only Mozambique hit the slightly above 20% of their GDP in taxation. If you're looking at debt as well, Mozambique still stands out, slightly more than 120. And there's a history behind why they have that high debt level to the GDP. But it stands out that a majority of the countries, except for DRC, Congo, and the Comoros, had and Nigeria had debt levels above 50% of your GDP. For the East African community, it's what is recommended is just to ensure that your debt level is below 50% of your GDP. For the South African region, it's 60%. But we note that there's still high debt levels across these countries. In terms of the sizes of the economy, Nigeria was the largest economy, looking at their gross national income per capita. But suffice to note, again, very interesting that it's the richest, yet it mobilizes the least in terms of taxation. Something worth reflecting on. But the point we're passing across with this is that the high debt levels and the low tax revenues then limit the fiscal space for that conversation of domestic mobilization for health and immunization. Now, looking at the financing trends, and here we're looking at three things. The domestic proportion to the GDP. We are looking at also the health budget relative to the entire government expenditure, and then also just looking at the spend per capita. For the spend per capita, the recommendation is $86 for universal health coverage. None of these countries met that threshold. Kenya was the highest at around 84, 85, looking at the period, the average between 2017 and 2022, followed by Comoros, and DRC was the least in that regard at less than $25 per capita. If you're looking at spend relative to the GDP, domestic spend on health relative to the GDP, the target should be 5%. None of these countries, looking at the average for the 5 years we're looking at, met that threshold. Now, looking at the controversial Abuja target of 15%. Again, I think the highest we had as an average was Malawi at slightly close to 10%, looking at the 5-year period. But a majority of these countries were still low. To that extent, one of the things we see is low budgetary prioritization, which then threatens access, quality, and sustainability, not just of immunization, but health services in general. If you're looking at the sources of this finances for health, what is in blue is government, and the conversation is really looking at domestic mobilization. You notice that on average over the 5 years that we were studying, the least the contribution from government was in South Sudan at 11%, and then highest was in Kenya at around 39%. All these are below 40% and therefore demonstrate significant dependence on other sources that are not predictable and other sources that are not consistent. To that extent, then that threatens the sustainability of financing of health and immunization. I want to draw your attention to what is in red, and that's external aid, so donor dependence. So you have significant donor dependence, and we see that significantly so in South Sudan, we see that in Mozambique, we see that in Malawi, we see that in Uganda. Again, I also want to draw your attention to Nigeria, where we're seeing on average about 75% of the financing comes from out of pocket. Now, that's significantly poses a threat towards high out-of-pocket spending and catastrophic expenditures. So financial hardship for the families, as it were. So to that extent, I think we are seeing a threat not just to sustainability, but also to financial protection, given the financing sources that we have or the low government spending. In terms of immunization coverage, and I'm keeping an eye on my time, I note, I think it's important to note that whereas the threshold or the target is have coverage above 90%, we notice that we have a cluster of countries that had their coverage for some of these critical antigens below 80%. And you will notice that most of these countries either had some element of conflict, whether affecting certain regions of a country, and that becomes something worth paying attention to, the impact of fragility on access to immunization and other health services. In terms of now narrowing down to immunization financing and the different sources, we note that what is in orange is what is coming from government, and what is in blue is from external parties. We note that the highest contribution from government was from Senegal, Nigeria, and Ethiopia, and the list was in Comoros, DRC, South Sudan, Malawi, and Mozambique. It is worth noting that across board, none of these countries is financing more than 50% of their immunization services on average, looking at the trend analysis between 2017 and 2022. And the majority of the external sources were largely from GAVI, WHO, UNICEF, but then the private sector contributions were not visible, as it were, in the country multi-year plans. This again just shows the trends for the countries, but suffice to note that about 2022, only Kenya and Nigeria had hit above 50% of the immunization contributions coming from government. Looking at all this, and I'm cognizant that I'm now past time, I think there are a few things I'd want to pay attention to. One is the need for investments to also spur public finance management reforms, because it's in addressing the taxation inefficiencies, it's in addressing the debt dynamics that then you're able to expand the fiscal space that then can allow more resources to flow into health and immunization. The other bit is the need to strengthen existing health systems, because immunization happens within those systems. And one bit we didn't show here is that the Universal Service Coverage Index, which shows the access to care, was very low across all these countries. So to that extent, if the underlying health system is weak, then immunization services will also suffer. Then we're also looking at reflecting on collective governance systems for accountability, because we notice there's a lot of inefficiencies that can easily be addressed through strengthening accountability systems and transparency for these resources to yield more value for money, as it were. Then, of course, there's a conversation of domestic vaccine manufacturing, and I know there's a lot that now GAVI is doing also together with Africa CDC, but then the conversation should also be towards contextualizing the investments based on the country levels, so that then where South Sudan is it a place, looking at their context, is it an access issue, or is it now a conversation around developing or initiating vaccine manufacturing conversations? So essentially the point there is contextualizing the investments. Then the other components that I think are important are around poverty reduction and alleviating the drivers of inequality, because we notice again there are inequalities around access between the income groups in the broader report. And then finally, looking at the impact of the pandemic, and also there is significant need for investment to target not just response, but also preparedness and prevention for pandemics and disasters. A good example for this is Mozambique, where they had 3 typhoons, which then destroyed or really disrupted access to care and also immunization services between 2018 and 2020. With that, I think I will stop there and hand over back to Vudzai. Thank you very much.
Thank you. Thank you very much, Dr. Mike, for that insightful presentation covering 10 countries in the region. I would like to encourage the audience to share their questions and comments in the chat. We're going to power through these presentations, and then we will give the presenters an opportunity to respond to the questions. So moving on to the next speaker. Our next speaker is Dr. William Manson. He's a senior manager for immunization financing and sustainability at GAVI. Will is currently, he is a medical doctor with an MPH from Johns Hopkins University and over 12 years of experience across disciplines, clinical medicine, health systems, grant management, and others. For this conversation, Will is going to be attempting to answer 4 key questions. First one, which I'm sure many of you are keen to hear about, GAVI's core financing and transition policies in 6.0. How different are they going to be, if at all, from what we have in the current strategy? Secondly, how is GAVI supporting countries to improve investments and to prepare them to transition out of GAVI support, as well as expectations from countries in the upcoming replenishment cycle, and any key messages for governments in the region. So welcome, Dr. Will, and over to you.
So much, Uzai, and greetings to everyone. I will start sharing my screen now. And I'm really delighted to be here and to have this conversation with you. And so for the next, so for the next 15 minutes, I will quickly go through this content. I will share a 2 or 3 minute impact story from the field, talk a bit about GAVI's co-financing model, a few of the things we are doing with partners like you to increase domestic resource mobilization for immunization, and then talk about the direction of travel for our ongoing strategy review. And then lastly, talk about the expectations from our multiple partners, following which I'm more than happy to respond to the questions and comments that colleagues here might have. And so I was actually privileged to be in Niger last week to supervise a few ongoing projects being carried out by our local partners. And this story makes me really happy because we, in a short time, in less than a year, we've started seeing really excellent results, even by way of increase in vaccination coverage, particularly in a place called Tahua. It's a district, and there's the name of a district and a region at the same time. And so the highlights of some of my conversations include discussions with the Relais Communautaire, who are community health workers that help with this. And this is a direct facility financing project. And so I won't be able to go through all the details. Money gets to the front lines much faster. And so all the planning gets to be done quicker than usual. The outreaches, which might not have happened in the past because the money is delayed somewhere and there are probably strikes, are also not happening. And then the community health workers, as well as other frontline workers, really feel appreciated for the work that we are, doing with them. And I'm sure that if we should open the floor, a lot of you will have similar stories to share, but I felt this presentation will not be complete if I did not share some of the real impact on the ground that GAVI is doing with support from multiple partners like those on this call. And so to quickly talk about part of our co-financing work that I'm sure a lot of colleagues here are familiar with. Just this year alone, we've seen great commitments from countries on the African continent towards acquiring GAVI-supported vaccines. And as of the end of August this year, we've been able to raise from African countries alone 103 million USD, representing 59% of all co-financing obligations for the year. And as you can see from the graph, over the last 5 years, in nominal terms, this is the highest we have been able to raise, which tells me that countries are doing a lot to own the process of vaccination and, their own health sovereignty. And so I thought this was something really remarkable to celebrate. Hence, I'm sharing it with you. And to quickly talk about some of the work that we are doing with partners, some of whom I have seen on the call, we are doing, in addition to all the advocacy that the full GAVI team is doing, one of our teams has been actively engaging on 2 specific multi-country initiatives to increase financing for immunization and primary health care. This has got to do with the multi-country CSO-led advocacy for immunization and PHC financing, as well as our work on budget focal points. On the former, we contracted the Global Health Advocacy Incubator, and currently we're working with them in about 10 countries at different stages of this to, help prioritize immunization financing in countries and do advocacy at different levels for these countries in order that the resources needed to acquire vaccines and deliver them are committed by governments, and then these things are done. We have lots of success stories from Kenya as well as others. And then on the budget focal point, it's an initiative that happens in a number of countries where GAVI supports either a core partner or an extended partner to hire a consultant based at the MOHRM or the Ministry of Finance to work together with partners in these ministries. And what they do to ensure that these monies are raised include support to budget preparation, advocacy with governments for PHC budgets, budget releases, budget execution, strengthening ministerial capacity, as well as coordinating with different partners to ensure that as and when needed, the monies are released in full and on time to ensure that our children who need the vaccines, as well as other people of vaccinable age, get the vaccines that, they badly need. And I'm happy to announce that we have so far, even though this has just been going on for a few years, registered some very good success. That's not the basis, for this particular call. And so I will reserve the details for another discussion. And I just also wanted to give a quick update on a meeting that I was privileged to support and help coordinate in Abidjan in July this year, where ministries of health and finance of our 10 African countries met and agreed on a number of commitments to ensure that countries that are in transition from GAVI or in the process of getting into the accelerated transition phase are able to do very well beyond the GAVI support period. And so during this meeting, about 8 commitments were made. And this includes increased domestic resource mobilization, increased budget advocacy, internal advocacy for increased budget allocations, investments in vaccines along the lines of AVMA as well as others, integration where not done into health policy, strengthening our monitoring framework, and also to create a platform where EPI managers and directors get to share best practices and the things that they've done in their countries to increase commitments to vaccination, as well as enhancing primary health care, and then collaborating with existing partners as well as new ones, particularly from the private sector, to implement sustainable resource mobilization strategies as well as boost immunization budgets. And so this meeting was a resounding success, and we are in the process of implementing these commitments, of course, with the countries in the lead. It was actually hosted by the Ministry of Health and Finance of Ivory Coast. And we are very happy at the level of engagement that we got from partners as well as countries who attended. And so I will take the next couple of minutes to talk about the transition from GAVI 5.0, 5.1 to GAVI 6.0. Please note that all that I'm about to share in the next few minutes are really the direction of travel on, and then the discussions on where we will be going. Some agreements have been made, but then the board will meet at the end of the year to formally ratify these and get them into our strategy. And so the eligibility transition and co-financing model, as I indicated on the first couple of slides, has so far worked quite well to drive financial and programmatic sustainability, with currently 19 countries successfully transitioned out of GAVI supports, and then huge levels of co-financing obligations paid by countries. And year in, year out, we have close to 100% of countries, maybe apart from those that might be suffering from severe humanitarian crisis, fully fulfilling their obligations. Going into 6.0, we are aware of some constraints in the macroeconomic outlook, as well as the rapidly increasing co-financing levels as countries move along the continuum of GAVI support. And then we've also noticed that even though countries might be increasing in GNI, programmatically, they might not be performing the way they need to ensure that the immunity that is needed is gotten in their countries. In addition, we also noticed that beyond the GAVI transition, where we have fully self-financing countries, there might be growing inequities leading to less than favorable vaccine coverage in some of these countries. And so for 6.0, we really have the opportunity to build on the past successes of our LTRACO as well as middle income country segment models to ensure that things are done. And as a result, we are thinking of certain shifts which will be seen in the 6.0 period, focusing on sustainability, and some of the costs I've also indicated on the slide. And so globally, this is what our 6.0 strategy looks like. We'll be thinking of these four major priorities: introducing and scaling up vaccines, strengthening health systems to increase equity in immunization, improving programmatic and financial sustainability of immunization programs, as well as ensuring healthy markets for vaccines and related products. And overall, as the name suggests, we have 3 policies, and then there's one that we are currently working on, which was not present in GAVI 5.0, which is the HSIS policy. And so we are thinking really on how countries can contribute to some of the operational costs of their vaccine programs, whilst strengthening these systems to ensure that with or without GAVI, the successes that have been chalked will be sustained. And so I'll take the next few minutes to quickly talk about the shifts that I mentioned. And so we are looking at 6 shifts from A to E. The shifts, as you can tell, different countries are at different levels: initial self-financing, preparatory transition, accelerated transition, as well as what is currently known as the middle income country segments, which is then going to be called the catalytic phase in 6.0. And so for shift A, and it applies mostly to countries in initial self-financing with usually the lowest GNIs per capita. And so would be giving countries a greater opportunity to choose their products, with the cost per dose being one of the major factors. And so with this, it helps countries save much more money to be able to invest in other elements of the vaccination delivery system. And then for shift B, we also noticed that given the variable duration of preparatory transition, the share of co-financing that certain countries pay tends to go very high, and which becomes quite burdensome for them before they even get into accelerated transition. The board task team is currently looking at capping by way of percentages the the amounts that countries will be paying whilst in this phase. And then also for Shift D, we will also be giving targeted support for new vaccine introduction for countries in accelerated transition. And then in Shift E, we also intend to put down some money for additional programmatic support for countries at risk. And this really applies to the countries in accelerated transition and which are on the way to leaving GAVI support. And so some of the things that we'll think about include increasing the eligibility threshold. And currently we are looking at a number like 2,300, which we hope will be ratified by the board later this year. What this means is that certain countries which would have gotten into accelerated transition will still remain eligible for GAVI support. And so the gains made in these countries, we are really able to keep. And then the last shift that we are thinking about would be multi-year waivers, either full or partial, for countries that are fragile. And so with this, we could give 2 or 3 years support after working together with our partners to assess the situation and, government's capabilities to fully finance their immunization programs. So once we all come to an agreement that it's going to be beyond the challenge, we set certain criteria. And then based on this, GAVI will support these countries either partially or fully in a multi-year phase. I think, and so to conclude, a quick note on expectations from all our partners who we've been working together with is that we are currently going through this replenishment cycle. So greater advocacy for financial support to support GAVI 6.0, greater commitments within countries for vaccine equity, increased domestic resource mobilization to strengthen national immunization systems. And also in the spirit of sustainability, where countries are able to leverage GAVI's health system support to develop plans that would ensure that all the gains made, are maintained and even improved beyond what GAVI gives us. And so I'm really grateful for this opportunity, and I hand back, the control to Vujai. Thank you so much for listening. Yeah.
Thank you very much, Dr. Will. That was very insightful. And I'm glad to see that some folks are already asking their questions and getting answers in the chat. I encourage us to continue engaging in the chat in case we run out of time. So we've heard from civil society through Dr. Mlongo's presentation, and we've heard now from GAVI. We're going to switch gears a bit so that we can hear from government. And so now I'm going to call upon Mr. Jimmy Ameni from the Ministry of Health, Uganda. Jimmy is currently steers GAVI grants within the Ministry of Health in Uganda. And his particular role is coordinating and synthesizing strategic program and grants management in the ministry. Jimmy has a solid background in global health and technical support for supply chain management. Now on to the questions that Jimmy will be answering this today. He is going to focus on Uganda's current experience in financing immunization within a constrained fiscal space. Secondly, best practices for successful advocacy for increased domestic resource investment in immunization. And then he will also talk about the challenges and opportunities in increasing investments in immunization. And finally, some key messages as GAVI launches its replenishment drive for 6.0 strategy. Now, I recognize this is a lot for Jimmy to cover in 10 minutes, because we really want the speakers to stick to their 10 minutes so that we can glean everything. But over to you, Jimmy.
Thank you. And I hope you can hear me clearly.
Yes, we can hear you.
Okay, so it's a pleasure to join this call and very insightful discussions, really listening to the previous speakers, but also a very good opportunity for all of us to kind of share experiences and picking picking an example of some of the engagements that we've been having that relate to immunization financing in Uganda. So I will start by, sharing critical milestones on the journey of immunization in Uganda. And I am picking on 1962 as the starting year intentionally, as around the time Uganda got independence, and then walking the journey through, the establishment of the program, and then through 1970, and as the previous speakers highlighted, that most immunization programs really usually get challenges whenever there is either political or civil unrest, and we had a lot of that in the 70s and 80s, which kind of affected the immunization program, and then getting this relaunched in early 80s, and then really attempting to build a stronger program in the early 90s, and then progressively onboarding a number of new vaccines through to date, with a vaccine portfolio of close to around 14 antigens currently, and with plans to actually roll over and introduce malaria vaccine in the coming year. And moving to the current status in terms of immunization financing. So we've seen a relative increase in immunization financing in Uganda. And this is linked to the new vaccine introductions that we've seen, ultimately pushing our co-financing numbers a bit high. We see in 2021, 2022, our co-financing obligation was at about 2.6 million US dollars, and that number moved with new vaccine introductions in 2022, onboarding IPV2, MR2, and yellow fever vaccines. And then we also progressively see a jump from about 3.7 to almost 8.1 in 2024, which is a very significant number in terms of co-financing. And this kind of ties into exactly what my colleague from GAVI was actually highlighting. So we see Uganda as a country that is still receiving a lot of support from GAVI, but having to spend quite a significant amount of money in co-financing, which is slightly higher than even some countries that are already in the next phases of transition. And then obviously, government of Uganda finances the traditional vaccines 100%, and while maintaining these high coverages. Then we are speaking of introduction and scale up of vaccines, strengthening health systems to increase equity in immunization. As we are all aware, with all these inequities that usually affect immunization programs in extending services across some of the hard to reach areas, and all that are aspects that we are attempting to bridge, and with support that we've been getting over the years, we've been trying to bridge this gap and just try to make sure that all the unimmunized and the zero dose children are targeted, and that we're able to extend services across. And obviously, speaking of that, that's also an aspect of ensuring that there is sustainability of the immunization program, with dedication from the government in progressively fulfilling its co-financing obligation, but also increasing financing towards other vaccine deployment activities, but also financing the traditional vaccines fully. And then also aspects that relate to staying alert to market dynamics. We've seen all these having to ensure that we have critical key performance indicators that we are monitoring, that could indicate some of the risks that could affect the program, be it supply market dynamics, be it supply vaccine availability, be it price increases in vaccines. So we monitor these progressively to just make sure that we stay abreast with critical aspects that would enable us to have a fully functional program. Yeah, moving on to the next to the next slide, and this picking on from the time globally, the rollout of the EPI programs, I kind of show you the trend in Uganda, I think picking from 1980 to date. We see the trend of the DPT coverages in the last 43 years. And one critical thing that I needed to actually share with our colleagues on this call is at the time GAVI support was introduced in Uganda in early 2000, you realize that the DPT1 was at about 86, DPT3 was at around 59, and over the years, we've seen a significant increase in these indicators, and that speaks to availability of resources and financing to be able to support the immunization program. Kind of points to the fact that there is need for continued financing of immunization programs and sustaining them as we speak, increased financing from governments and not actually relying on donors. We'll move to the next slide. And in terms of the impact, I know that at the start, the colleague from South Africa highlighted the impact and why it is very important to actually invest in immunization. So in the case of Uganda, we see the child mortality performance. You'll realize that around 2000, when, before, around the time GAVI came in to start supporting us, the under 5 mortality was, close to around 151. And in the recent years, this number has significantly dropped to about 52. And surely, if anyone wants evidence to show the importance and the impact that immunization can have on an economy or on a country, these numbers don't lie. And it's a sure way to continue getting the right kind of investment to ensure that there's economic development in any kind of state that is actually weighing options on where to invest the scarce resources that are available. Next slide. So what are some of the best practices that have enabled us to successfully advocate for resources over the years? You realize that there's been increase in financing to the immunization program with quite very drastic and increased amounts in the recent years. So in there, we've been focusing on leveraging strong political will. I think in the context of Uganda, we do have a very strong political will to actually support the immunization program from the highest office. That would mean the president of the country as a very critical champion in supporting immunization. We do play a critical role in making sure that all key stakeholders are actually involved, and with support of partners. For example, PATH has been playing a very critical role in Uganda in bringing together all the partners and ensuring that we are advocating with all the key stakeholders. We've severally had meetings with parliamentarians, with key decision makers, but people that that are in the critical aspects of making decisions, mapping out the entire budgeting cycle for the country, knowing the key entry points on when we need to advocate, when you need to be able to share which messages to the decision makers to make sure that aspects that relate to allocating adequate resources to support immunization are availed, delivering the right evidence at the right time. This has also proved to be a very critical aspect in ensuring that we sustain and are able to actually attract financing and increase financing whenever we kind of do the kind of analytics that we've been doing, showing the trends on immunization financing, showing the variables that might affect the current allocation of resources, showing the impact of the depreciation of the shilling, showing the impact on the price changes, just making sure that critical information like that is available for key decision makers to see how that would impact critical activities like supporting immunization, maintaining political support, and effectively and efficiently utilizing deployed resources. The previous speaker did highlight the importance of accountability and making sure that the resources that have been provided are effectively accounted for, to kind of build confidence in people having to actually deploy resources, well knowing that they are going to be used for the intended purpose. I'll move to the next slide. What are some of the challenges and opportunities that we see that could impact increase in investment or that we see? Obviously, the epidemic response. Over the last few years, we've seen an increased burden on immunization programs due to concurrent epidemics and disease outbreaks. We saw COVID, that kind of disrupted immunization programs. Following that, in 2022 in Uganda, there was an Ebola outbreak. And, you know, when we speak some of these outbreaks, most of them will kind of push, especially when there are vaccines that might be available in different contexts. Some of these diseases, probably there are vaccines that are still undergoing, you know, studies. Most of them have to be deployed in quite very in mechanisms that are not the usual routine immunization schedule frameworks. We are deploying emergency use listed vaccines with the complexities that are involved in having to deploy such vaccines, and you know, that kind of in part disrupts the immunization program. We are now speaking Mpox. There's an Mpox outbreak, and we are also now making arrangements on how to roll out the EUL listed vaccine in that context. Campaign running costs. We've seen over the years, several campaigns have to be undertaken, especially when you have all these outbreaks or when you have supplemental intervention activities attempting to address any outbreaks or any gaps that the programs could have encountered in the process of running a routine immunization schedule. Cross-border health risks. When the colleague from Perth presented the performance of some of the immunization programs, I was looking at DRC, and I said, and then I was looking at South Sudan, and then you realize that Uganda, these are actually neighbors to Uganda, and that means if they are posting suboptimal coverages or numbers like that, it means that wherever there's cross-border movement and all that, it doesn't matter how strong your immunization program is, you will actually face these cross-border risks. And then the communication strategies that are in place. I think we've seen growth in kind of hesitancy, misinformation and disinformation all over, and this is also proving to be a very huge challenge. And whenever we go to engage critical stakeholders to provide additional financing to immunization, that now becomes a whole different and complex discussion, which is also a very critical area that we hope that progressively we can keep discussing. And then the program load, I did mention all these epidemics, all these diseases. Definitely in terms of running a program, this ultimately pushes the program to actually undertake on quite a lot more than what ideally a routine immunization program should be able to undertake in terms of the scope of work, beyond having to run the immunization program to manage a routine immunization schedule. There's now a whole mix of responding to all these outbreaks and then having to sustain the immunization program. Next. What are some of the key messages as we discuss? I know my colleague from GAVI did highlight the framework for the 6.0 strategy and some of the aspects that they are looking at in the context of the country. We look at aspects that will ensure that there is increased access and demand for immunization services. So investments in that framework would be very critical. availability of potent vaccines and effective vaccines. And this calls for continuous investment in infrastructure, cold chain systems that would enable us to be able to effectively store, but also move and monitor ambient temperatures for these vaccines, and then build EPI management capacity at all levels. I did talk about the overload on the typical immunization program, with having to deal with all these new dynamics and dealing with the outbreaks and the different pandemics that we are now faced with, and monitoring disease trends and program performance as a critical area, and strengthening surveillance and diagnostic capacity is also a very critical area, especially now that we are talking of all these outbreaks. So early detection is critical in ensuring that we actually address this, and then contributing to policy standards and guidelines formulation as a critical way of ensuring that we have an effective framework for actually supporting immunization programs. Thank you all. That's what I had to share with you.
Thank you very much, Jimmy, for painting the picture so well for us around Uganda. I am going to call upon our next speaker from Malawi, Ms. Emily Chirwa, the Deputy Director of Planning and Policy at Ministry of Health in Malawi. Emily is a highly experienced and passionate economist with over 20 years of experience in the public sector, particularly in the areas of health financing, resource mobilization, project management, policy formulation and analysis. Her extensive career spans various leadership roles within the Ministry of Health and the Ministry of Finance, where she has made significant contributions to national development initiatives. Emily is also going to be answering similar questions to what Jimmy was answering, but around the context of Malawi. So Malawi's current experience in financing immunization within a constrained fiscal space, the best practices for successful advocacy for increased domestic resource investment in immunization, the challenges and opportunities in increasing investments in immunization, and finally, some key messages as GAVI launches its replenishment drive for GAVI 6.0 strategy. So Emily, over to you, and you have 10 minutes.
Thank you so much for the opportunity to be part of this important conversations. I'm trying to share my screen. Please let me know if you are able to see my screen.
Yes, it's on now.
All right, thank you so much. I have 10 minutes. Let's see how we'll do. Yeah, so just to give you a snapshot in terms of our health financing situation in Malawi, our total health expenditure is at 39.9, that's $40, quite low compared to the $86 as advocated by the World Health Organization. But also we have tried to cost our health sector strategic plan, number 3, and the cost to implement that is at $172. So you can see how constrained we are in terms of our expenditures in health. I've moved to the next slide. So I just want us to also focus on this slide. This is where also our problem is. So out of the $40 that we are providing for health, government is providing $10, and we tried to also dive deeper just to see what we are spending on as government. So out of the $10, 10%, which is $1, is for development. So this is for infrastructure equipment. Medicines, we are spending $2. Operations, we are at $2, and a huge chunk of this is going towards personal emoluments, and it's quite obvious. These are statutory expenditure that government must pay. Government, whatever happens, must pay salaries. So PE is getting about $5. So this is where our problem is. our external partners are providing 55%. If we sum up all the domestic financing, we are 24%, and government is 24%. And if we add in private sector and out of pocket, we realize that we've got a long way to go as a country. So in terms of coming into immunization background, our program for immunization started in 1979, following WHO's establishment in 1974. So yes, we've done it for quite a number of years. Approximately, we are offering 13 types of immunizations targeting children, adults, and specific groups. So we've got tetanus, diphtheria for women of childbearing age, just to mention a few. So what are the key milestones and achievements that we've so far? So I'm just mentioning a few. Our program manager for EPI, Dr. Kisema, is also online. He's a very passionate guy. He's been very passionate, and he has worked so hard in as far as this area is concerned. So despite the challenges that we are going through, our rates are high at 90%. Yeah, suffice to say that we also suffered during the COVID, and we experienced some dropout rates, but currently we are at 90%. We managed to eliminate polio, and yes, it was thanks to the dedication that the EPI team, with leadership from Dr. Chisema, we had lots of campaigns, so we managed to eliminate, but also with support in terms of regional coordination with our counterparts in Mozambique. We have also seen reduced mortality rates for neonates, and part of it has been attributed to immunization, the program. Yes, we've got the expanded vaccine coverage program. So this is a program that now under this we are now including newer vaccines such as the pneumococcal conjugate vaccine, PCV, and rotavirus vaccine. We're also protecting children from additional diseases. We have strong partnerships. So like I said, government is only giving us $10 for all health. So this is also part of the headache that I have, heading health financing. I'm here attending this meeting talking about immunization financing. Last week, I was in another similar scenario. We were discussing sexual and reproductive health, but we are targeting at $10 that government is providing. This is a headache that we have, and as a country, we are also saying, is it possible that we should move into integration? So I'll talk about it in my following slides. But we've got partners that are supporting us. GAVI has been there. GAVI is doing a lot. I will show you some graphs that you'll be able to appreciate what we have also been able to achieve with support from our partners. Yeah, so in terms of the rates and then the challenges, I've already talked about the 90%. Yeah, but with COVID, we experienced dropouts. But generally it was less than 10%. But really, we noted that people stopped going to our hospitals. There was a lot that happened with COVID, but slowly we are catching up. Our focus is to reduce the equity gaps through supply chain, cold chain, but also improved logistics. So in terms of our partners, who is financing immunization program in Malawi? So government provides the operational costs, it pays salaries, but also there's a component of financing that government provides towards the actual procurement of the commodities. So we've got GAVI. This is our biggest partner. We have the Health Services Joint Fund. This is a fund within the Ministry of Health, co-financed by KFW, Norway, and FCDO. So yeah, some of the partners within this have also been providing a top-up towards procurement of vaccines. UNICEF has been a very good partner in terms of procurement. So we procure our vaccines through UNICEF. WHO is another partner. I did not include in this, but they've been a strong partner of the program. So in terms of the actual financing, so government is providing 30%, and donors providing 70%. So this is how low we are if we are talking about sustainability. Going forward, we really need to make sure that government really pushes up. Yeah, so in terms of the expenditures, I just wanted to, just to show you in terms of that. So government is maroon. The blue color is the Health Safety Joint Fund. And you can see that GAVI is the one providing the huge chunk of the budget for procurement of vaccines. So what then? So we have the health sector strategic plan number 3, but also the national health financing strategy. We are trying to boost the major drive of our health financing strategy is to boost domestic financing, as we are talking about sustainability. So what are the objectives? Mobilize adequate resources for health, effective pooling and management of resources, strategic purchasing, value for money, but also institutional arrangement for effective financing. I'll not talk to all of them, but I just want to focus on mobilizing adequate resources. So this is where we are also saying, what can we do so that we are able to mobilize resources within Malawians? So in Malawi, healthcare is for free. The question is, how free is this free care? So when I go to the hospital, I can get a sophisticated surgery, a brain tumor can be removed. It's for free, but there are costs to that. So we are also struggling as a country to support this free care. But we have also noted that we've got Malawians who are not poor, Malawians in the informal sector, but not contributing towards taxes. So we are saying, how best can we bring them on board so that they also start contributing towards care? So there are a number of strategies that we would want to use. So we're talking about earmark taxes. Everyone gets sugar. Everyone gets sugar. And it's one of those commodities that when we have shortages, we see queues, people queuing. So if we say maybe a 5 cents or 10 cents on each packet of sugar, we believe that we'll be able to target a lot of Malawians to contribute towards taxes. So it's an area that we've already discussed it with the Minister of Finance. We are doing the analysis just to see which areas we can collect meaningful amounts. But we have also seen the power of advocacy. So through the Africa's leadership meeting, I think some of us are aware of the financing dialogue. I'm happy to report that Malawi was the first country to do the dialogue. I think when countries were approached, they were not bold enough to do the dialogue, but Malawi was bold. We conducted, and it was quite successful. On our last day, we had the Minister of Finance, the Minister of Health, Minister of Local Government on a panel. So through that, we have also learned the importance of sharing the evidence with our colleagues from Ministry of Finance, Parliament, all the key stakeholders, even the civil society. And even we have a health financing technical working group whereby all partners, civil society, ourselves, and other governments would discuss health financing. How can we mobilize more resources for health? And when I say health, and I mean immunization is also included in that. Private sector engagement. Through the dialogue, we have a forum now where we meet private sector. So these are some of the issues that we also want to bring on board. How best can we involve the private sector to come in and support immunization? So they can come in as part of their corporate social responsibility, but also those private sector that can come and invest in health as a business. How best can we work together? So it's high time we're also trying to inform Malawians and even our private sector that health is a productive sector. It's not just a social sector whereby it is just there to spend, but they can also come and invest and do business. Voluntary health insurance is another area that we are also trying to do. We are trying to push all the formal employed into insurance so that we are also providing space, relief, and even reducing congestion in our public setting. We have optional paying services. We are also trying to push in that to see if that can also help us to mobilize more resources. So really our drive at the moment is to make sure that we are able to mobilize resources. I heard when Gav was presenting, they talked about that DFF. So I think it's something that as Malawi would also want to learn from you. if we can work together on that. So we are also actually, I'm in Blantyre, and we are doing the first trainings for our direct facility financing. It's another reform that we have also introduced, having learned from our neighbors from Tanzania. So we are also trying to learn to see how best we can also support frontline facilities. So actually, it's a reform that we are pushing, and already we have made a lot of progress. We started last year. Our health financing was launched last year in January. So already we have made a lot of steps, and so DFF already we are on it. Would want to learn how we are doing it so that we can also maybe adopt it as we are implementing ours. So what works in Malawi, what works and what has not worked in resource mobilization. So there is that pressing need for health and the immunization interventions in the country. We are on a big agenda in Malawi to integrate. So we are moving away from verticalization. So we have seen the cost of it, and we are saying let's integrate. So there are a number of works that we are doing. A consultant is on the ground to help us come up with an integrated service delivery package. Community engagement, this is also another area that has worked. I talked about the dropout rates. We didn't have to go into the community, engage them to make sure that things should improve, and we have seen the improvements. We have also seen the importance of putting of the resources under the Health Services Joint Fund, where partners are putting in their resources, and we are through that. We are also supporting immunization programs. And also government contribution, we have seen an increase, especially for this financial year, but we have seen a slight drop. Yeah, but we have seen the commitment from Ministry of Finance to give us a budget line strictly ring-fenced for immunization. What is not really working is the budget target, but with the engagement with the Ministry of Finance, we envisage that things will improve and that figure will start going up. Yeah, despite the low fiscal space and despite the low budget, we have low absorption. It's something that we were also trying to work on. But also we have seen that partners at times they'll focus on other commodities. So we are trying to also to bring in the data and the evidence to push for some of these important commodities. Yeah, I've talked about this slide. So key messages to all of us as a country, we recognize that immunization is critical despite the verticalization, but we still appreciate the importance of immunization. So, and we have seen what it has done to our health system, but also to our population. So we can never undermine the importance of immunization. We also acknowledge that it is cost effective. So it's something that we need to do. We are also developing a program or a health technology assessment program within our health financing strategy. Yes, so we already know that vaccines are cost effective. It's a cost effective investment. Yeah, we just call upon our partners to support us in the health financing reforms. We really want to bring in efficiency. We have seen that out of the, you can imagine, out of the $40 per capita, our administrative costs are at 24%. I think it's quite high for a country already struggling to make ends meet. So we're also trying to see how best that can be done. So we have moved into the one planning, one budget reform. Already we are making progress. We are into the second year. Yeah, but also we also want to call upon our partners to support our priorities. So in terms of the supply chain, we have seen that sometimes partners shun away from investing in infrastructure. We can't talk about healthcare outside infrastructure, equipment, yeah, all that. So yeah, in a nutshell, this is what I wanted to share from Malawi. I have my colleague online. He's the man behind all the successes we hear about immunization in Malawi, Dr. Chisema. Thank you.
Thank you. Thank you very much, Emily. And also recognizing Dr. Chisema, thank you for all the work that you're doing in Malawi together with your other colleagues behind the scenes. So colleagues, we are just at time, just a little bit over time. We wanted to just request if you could indulge us to have another 10 minutes if Honorable is able to join, so that he can give his quick insight that he was supposed to have given previously. And so if you could indulge us, we would really appreciate if you could just give us another 10 minutes and then we will close. Honorable Makalanyane, are you able to connect now? Okay, so Honorable might still be having challenges connecting. Honorable, can you hear us? Okay, so it sounds like it didn't work out today, but hopefully we can share his insights and presentation together with the rest of the presentations that you've had today. We've had an incredible 1.5 hours. Time has gone by very quickly, and I'm just going to call upon Esther Nasike from PATH. Esther is the Global MNCH and Immunization Advocacy Lead to summarize the key takeaways and give the closing remarks. Over to you, Esther.
Thank you so much, Vudzai, for an excellent job. If you think you enjoyed Vudzai's moderation today, kindly share some hand claps. Let me see some virtual hand claps, or whichever way you want to express that. I think we will appreciate it. Thank you so much for the excellent job. And as we come to the close of this insightful and also very important discussion, I want to also extend my appreciation to our speakers that you have heard from this afternoon or morning for some of you, and also to you all participants who contributed to the critical conversation on financing immunization in Africa. We have seen your comments in the chat. Some of you are also posting your questions through the Q&A tab. We have taken note of those, and you may not have had an opportunity to raise your voice or to share your questions with the participants, rather with the speakers. But what we promise is we will send the questions to all the panelists, and once they have responded to them, we will share that back with you with the other presentations and other documents that we have promised to share with you all that have requested for them. Actually, for everybody who registered for this webinar, you'll be able to receive the information from us, so you can rest assured of that. And today, we've had a lot of the fact that it is now urgent more than ever to have this conversation on financing. We cannot afford to lose the momentum. The numbers of zero-dose children that we are still talking about in 2024 are really a reminder of the work that we have ahead. Because what we understand is these children definitely need us as advocates, as decision makers, as the people that discuss policy at different levels, whether at national level or global level. These children need us, and we need to do something. The experiences that we've had from Malawi and Uganda show us that definitely progress is possible. But they remind us that we need to sustain commitment and collaboration at all levels, so that we don't have graphs that are going up and down, increment in financing one year and then another year. We cannot sustain that. So we need to ensure that we are committing resources, but also we are sustaining the resources that are committed. And that means advocacy is still important. But also that reminds us that we have a shared responsibility as governments. You've heard from the government representatives, but also as the donors, as civil society partners, as the normative agencies, we still have a lot of work to do together. So what you shared through the Menti, the feedback that you have provided, we still think that as a region, specifically Africa, we need to think about a shared vision around advocacy for immunization, so that we improve coverage, we improve financing. And so this month, we have the opportunity to work together with organizations like WACI Health, the GAVI Civil Society Constituency, AMREF and others, Village Reach and others, to convene advocates, to convene EPI leaders, representatives of normative agencies to come together to draft a strategy, an advocacy strategy for immunization for the Africa region. What that means is we have the opportunity to read from the same slate as people discuss financing and the importance of ensuring that countries are committing resources, but also donors are committing resources to GAVI. What do we need to do? So this engagement that we are having in Addis is the opportunity for us to discuss collectively what needs to be done to support the advocacy at the various levels and who we need to be speaking to. Maybe there are audiences that we need to target that we have not traditionally reached out. So it is an opportunity for us to put together a very strong advocacy strategy to help us drive momentum in this regard. So if you're interested in being part of this work, please feel free to share to share your information with PATH. Myself and other PATH colleagues online will be able to follow that up with you, because also while it's important to develop a strategy, implementation is not a one-man show. So we need to still work together as partners that are supporting immunization in the region to implement the advocacy strategies that we are developing. So thank you so much again for your time, for your expertise, and for your dedication. I'm going to close it here and wish everybody a good evening. But also before I close, just to appreciate the partners that have supported to put this together. Again, my colleagues at PATH, colleagues from WACI Health, the GAVI CSO Constituency, and Village Reach that made it possible for this to happen. And again, to our panelists and speakers, including Honorable Mokothu from Lesotho, also the chairperson of the Network of the African Parliamentary Committees of Health, who was not able to speak today, but we know we'll have another opportunity for us to hear more about how we can work with the NIAPACO, the Network of the Parliamentary Committees of Health, to advance this work. So thank you so much, colleagues. Let me wish you a good rest of your day. Bye.